we are now faced with a huge burden of elder care as well as child care, and no real infrastructure to deal with either of those burdens. And that's falling generally on the whole on women and also on men. So I think flexibility for both for in the workplace is very important. We're seeing that, during COVID, people's productivity actually went out working at home, and now all these companies are demanding, due to real estate issues, demanding to come in place in hospital, and that's creating a burden. I don't think people understand the different fields in medicine where you can't get out of your clinical duty, but if you do virtual, you have an option. So I think that needs to be really weighed against just being present. I think women are making more than 50%. I think the flexibility is a real key. I think women tend to understand that issue a lot more coherently than men do, and I think that we need the pay gap to close, and the only way to really have a leadership with women in leadership, having an equity of balance and being able to pull people through and have that. We have problems in our whole sectors, business, healthcare, law, everywhere women are faced with these challenges. And I think that gap really needs to be closed in healthcare. I mean, I think it's better now than it was 20, 30 years ago, where we didn't have the internet, social media, and those kind of resources. However, I think it's important to have someone to explain things to you, like what a T32 is. Should I do a master's during my fellowship? How to make my presence felt, and how to get into societies and before the people that matter. So it's very important for people to share the knowledge, not be restricted and waiting for questions necessarily. Sometimes people don't know what to ask the young people. I think I lost a lot of time because I just didn't know, and kind of put myself a decade behind. And I think that's very important for people to give guidance and to show them the path.